We will be talking about a very interesting medicine that is Nicorandil. Now, Nicorandil is one of the very commonly used drug almost by all the cardiologists in unstable angina, stable angina, in ST elevation MI, in non-ST elevation MI, in unstable angina. Any patient presenting to the casualty where we suspect that it can be cardiovascular related, it can be angina related. There, the patients are very commonly put on Nicorandil. Now, it is an anti-anginal drug. It means ki it is supposed to reduce the chest pain. Now, how it does it act? It acts through, it actually activates the ATP sensitive potassium channels. By that, it causes hyperpolarization of the smooth muscles of the blood vessels. Now, what actually happens is it causes not only the arteriolar dilatation, but it is also associated with venodilation. And this arteriolar dilatation is supposed to be because as this Nicorandil also acts as a nitrogen oxide uh, donor. So, and this nitrous oxide causes arteriolar dilatation. And this arteriolar dilatation, along with the relaxation of the blood muscle, smooth muscles, so there is an arterial dilatation also with the venodilation. So why this arterial dilatation is important? Because there is an increase in dilatation of the epicardial coronaries. Epicardial coronaries means the right coronary artery, the posterior descending artery, the left anterior descending artery, the left circumflex artery. These are all epicardial arteries. Means epicardial means those arteries which are actually present above the myocardium, because these vessels are actually present over the muscles. So this Nicorandil not only causes the dilatation of the epicardial coronaries, but it also improves, or it also causes dilatation to the deeper resistant vessels. So just imagine that this is the myocardium. This is the myocardium. So the epicardial artery is coming here, and this epicardium artery actually goes inside and it supplies the muscle. So this Nicorandil not only dilates this epicardial artery, but it also dilates the resistance muscle which is going inside the myocardium. So the area of the myocardium which is getting lesser blood flow, where which it is getting an ischemic insult, those myocardium also get a better blood flow because of the increased dilatation of this deeper muscle penetrating arteries. So the angina reduction is very beautiful. They don't have any effect on contractility or conduction. So there is no any problem with the contractility or conduction, and they are definitely have shown to reduce the chest pain frequency, as well as because of the improved oxygenation, improved metabolic effect, there is improved exercise tolerance. So because of these effect, because of the dilatation of epicardial and deeper resistance vessel also, they are so said to be cardioprotective, and they are said to have ischemic preconditioning. Now, what is this ischemic preconditioning? Now, this ischemic preconditioning is that just imagine that the patient has ischemic heart disease. So there is one artery which is getting constricted, or one artery is not getting blood flow. So this Nicorandin is supposed to cause dilatation, but this dilatation will not be in that artery which is normal. So there will not be any significant dilatation in a normal artery. So if the patient has suppose LED stenosis or thrombosis, and if the RCA is normal, it will not much dilate the RCA, but it will cause dilatation of the LED. So what actually happens is that this total blood flow to this myocardium remains more of a unaltered, but the more blood gets shifted towards the infarct related artery or ischemic related artery, and this gives a better flow to the myocardium which needs more blood flow. So this is called an ischemic preconditioning effect, which is there with the Nicorandil. This is available in both tablet and injectable form, and orally also it is very well absorbed. Nicorandil very commonly causes flushing, palpitations, headache, dizziness, nausea, and most of the time this headache, dizziness, palpitations, if it is severe, the dose of the medicine can be definitely reduced, and these symptoms usually appear after a few hours of starting the Nicorandil. Nicorandil after any patient when it is presenting with chest pain, if the patient has unstable angina or non-ST elevation MI or ST elevation MI, Nicorandil is very commonly given by IV intravenous route for around 24 to 36 hours. In fact, it is even very commonly given after thrombolysis or after doing the primary coronary angiography or angioplasty of the infarct-related artery or ischemia-related artery. So it is very commonly given in injectable form for 24 to 36 hours, and after that, the patient can be put on tablet form for few days, few months. Orally, it is given as 5 milligram tablet twice a day, and if it is needed, that can be increased up to 20 milligram per day orally. So this is one of the very important, very commonly used anti-anginal drugs, and that is for now. Thank you so much.